Advances in language modeling have spawned a very lucrative space in the tech industry. However, adoption into the medical device industry has lagged significantly. My name is Thor, and I'm a software engineer focused on machine learning and AI at StarFish Medical. And there are several reasons for this lag, and let's start with the premise. You're developing a medical device that uses language models. Your first option is to train it yourself, which gives you incredible control over the model. But if you need the model's output to be consistently human-facing quality, it'll need to be pretty big, at least a few billion parameters, and trained for trillions of tokens. Each of these alone imposes some significant burdens, which is why you only see new foundational models from big tech incumbents like Microsoft or Meta. Your second option is to use Microsoft or Meta's models yourself. Fine-tuning is much faster and less hardware intensive, but you still need data and access to decent hardware, either owned or rented. Your third option, of course, is to use third-party services like OpenAI or Anthropic, which give you access to incredibly large models without needing to host it yourself, and also potentially allow you to do some fine-tuning for your specific task. This is where regulatory requirements come into play, though. The FDA, for good reason, is very risk-averse. Even in straightforward devices, this risk can include malfunction or input errors, and with something like a complex large language model, where the breadth of your inputs and outputs are natural language, it naturally makes them very nervous. On top of that, if you use a third-party service, the model could potentially change out from under you, or suddenly no longer be accessible at all. Besides the astronomical business risk, if the AI component is important, this poses significant risk to patients too. So where do I think this technology is going? I think the best point to compare to is the field of computer vision, which had its hype a while ago. Medical imaging devices are also by far the most common machine learning-enabled systems approved by the FDA. In these systems, we see technology used to provide initial classifications or object identifications for overview by clinicians. Its purpose is to speed up workflows and assist expert users just be faster experts. We don't see systems where a patient sits in front of a full-body scanner and a big screen flashes healthy or sick. Currently, the big push for generative AI, like chatbots or assistants, is just a misapplication in terms of medical devices. Regulatory bodies clearly already see the value of machine learning-based devices, but less flashy roles focused on improving the speed or standard of care in medical decision-making. That's where I think language models will find their long-term place, becoming smaller, running faster, and being overall cheaper. To learn more, read my blog and follow us on LinkedIn.